I don't think it is dead. There is a great need to do something. We do have some people who are always going to say, if it can't be perfect, I'm against it. Those are not the kind of people who ought to be in elected office, because that's not the way a democracy works. So I believe you are still going to see a pretty good bill.
And what do you believe, Ron Paul?
Well, I'm afraid he's right. That something will come down. Since I take the approach that we don't need more government in medicine and blame so many of our problems that we've had too much government in medicine already, so I'm not anxious for anything to come. But really, the question is how do you pay for it? And I think more and more Americans, at least now, are getting worried about how you pay for it. And even though I have an idealistic approach to medicine and everything that I do, that we should do it with less government, I do think everybody should be concerned about paying for it. And that is the reason why I can hardly talk about anything economic without talking about foreign policy. And that's why I've emphasized that the waste overseas is so bad and it gets us into trouble. And we're fighting these wars that are never declared and they're endless. So I'd save hundreds of billions of dollars by bringing our troops home. And I would be willing to put a lot of that into medical care. But I still wouldn't endorse the idea that we need more government management of care.
Do you both philosophically believe that no American should go without health care?
Well, I don't think we can guarantee that by the government. But Larry, I have to say something first that I am afraid is going to be very disappointing to many of your visitors, your viewers. I agree 100% with what Ron Paul just said. The hundreds of billions, the trillions we are on the verge of wasting in wars that do us more harm than good, that's really very important. And Ron Paul has spoken very accurately, and I agree with him on that. I do believe that we ought to have a system that extends medical care, but you can't guarantee it. I think we can do a lot better in providing it. I would also say that, an example of my difference with Ron is, I think Medicare is a good thing. I think for older people, they are better off on Medicare than what replaced it, and that's government medicine. I would also say the most popular form of medicine, as it's practiced in America, in my experience, is the wholly government medicine that is dispensed by the Department of Veterans Affairs. The veterans I talked to would get very angry if someone said we're going to abolish the medical services of the Department of Veterans Affairs, which is, after all, wholly government.
Congressman Paul, would you agree that the public at large does not want you to fail again, to come up, you as a body, to come up with something that improves what we have?
Well, everybody does, but I might believe very sincerely that you can improve it with less government. Others would believe that you have to have more government. For instance, in the imperfect world that we have, I don't think we should be cutting out funds from Medicare. It's in big trouble already, but they were talking about taking $400 billion out of Medicare to so-called pay for these others. That doesn't make a lot of sense. No, I agree with the idea that everybody should have good health care, but I just don't believe that government delivers on their promises. That when you think about houses, we were going to give everybody a house, and look, the poor people lost their houses. It was good intention, but the programs didn't work. So that's why I'm afraid that when you promise people health care, that some of them will come up short.
I think there's a difference. The mistake that was made by, frankly, the Bush administration more than anybody else, but some others joined in, which was to give everybody a house to own. I continually argue that for some people in certain economic categories and in some social categories, rental housing is the appropriate form.
But Barney, didn't you support Fannie Mae and the like?
For rental housing, yes. I was very critical. In 2004, George Bush ordered Fannie Mae and Freddie Mac to start buying low-income mortgages for low-income people. I opposed it. I made a big distinction. I think pushing people into owning houses when they couldn't afford it and weren't well organized enough to do it was a mistake. I was pushing them to do more rental housing, and that's a big distinction. We also wanted to
see. I don't think that we should make those decisions. He may be right about what you should have rental or buying. I like people to make their own choices. But I do think that we push some of these programs with community reinvestment acts and easy credit. There were a lot of things that encourage this, where I'm convinced that if we had a little sounder monetary system and we didn't have this so easy credit, people wouldn't be making so many mistakes.
I have to respond to that because Ron there has got it backwards. The Community Reinvestment Act is not the problem. The Community Reinvestment Act only covers banks, things that are technically called banks, that take insured deposits. They made a small percentage of the bad loans. The bad loans were made overwhelmingly by banks not covered by the Community Reinvestment Act, and the problem was too little government, not too much. You had private citizens lending money to other private citizens without regulation.
Right.
Many of us tried to get rules adopted to prevent that because we saw the negative consequences. The Community
Barney,
Reinvestment Act was not involved.
Barney, I wanted to bring it up because I didn't want them to think that we agreed on everything. But no, okay, go ahead.
Right. The Republicans today had a freeze today for a few hours on the debate, insisting that the 767-page amendment be read aloud. There's obviously some stuff. Key question, Barney and then Ron. Barney, are we going to get a bill?
I believe you will. You know, that's just an anachronistic rule. They used to read things aloud in the Parliament in England in 1600 because they didn't have any typewriters, much less computers. That's the kind of anachronistic rule that ought to be, done. But I think you are going to get a bill.
Ron, we're going to get a bill?
No, I'm saying that we will not. We will get something, but not a real bill. I think there will be some incremental increase in government involved in medicine, but it won't solve our problems. So I guess in a sense there will be a bill, but it's going to be very, very minimal. But it'll be just something where they can say, oh, we did something. But we've been doing this for 35 years, incrementalism, but we have corporatism. The corporations run this show. The drug companies, the insurance companies, the management companies, the AMAs, they run it. So the corporations are still being protected even with this administration.